You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success. I have Dr. Gilbert today with me, and it's an interesting life of accomplishments that we want to unravel. How are you, Dr. Gilbert?
I'm fine, and my name is Jan, as in January.
Oh, okay. That's great. So I'm going to call you Jan from now on.
Well, that's great too.
What do you think made you a successful person so far?
Well, it depends what you consider my success. I said to my cousin, I said, I don't really feel like I'm a success. He said, "Look, you have a beautiful daughter, you have a great marriage, you have a terrific wife. You were a dentist for 43 years. How could you not be successful?" I said, "I'm not one of those wealthy dentists who retire with a boat and a huge house and a car and a portfolio of several $1 million. I didn't do that. And he said, "Why not?" I said, "I'll tell you. I used to do what was best for the patient, not what was best for the office. And you make a good living. We went on vacations. My wife has a fur coat, even though it was made by my cousin in California. And jewelry here and there, even though I think I have very low regard for jewelry of any kind. I think what a waste." And my wife quickly points out that, every country in the world has jewelry, and you don't like it. I said, "No, I don't really like it."
So what do you think are the qualities and routines and habits and things that you do every day that got you to this point?
Well, at this point, I retired in 2014. And after I retired, my colleague said, "Well, after you retired, you became a great dentist." I was always a good dentist. And what they meant was what I started to say and do after I retired. And I started, first of all, I had time to actually think about the practice of dentistry. Otherwise, I was just doing it. I was doing the stuff of dentistry, getting up in the morning, fixing, repairing, breaking down, building up, cementing, re-cementing, doing all that stuff. And I never really thought about it. But once I retired, I had time to think about it. And I developed a cure for periodontal disease. So I went to the American Dental Association and I said, "I have a cure for periodontal disease." And they said, "There is no cure for periodontal disease." And I said, "What are you, nuts? We're going to put a man on Mars and you don't think dentists are smart enough to cure gum disease?" Well, they didn't accept it. And it's so simple. It's so simple. I just found out what caused it. And no matter where you go, the American Academy of Periodontology, their website, whatever textbooks you read, it says gum disease is caused by unclean teeth. It says that everywhere, and made worse by poor nutrition. So I said, okay, I got the nutrition part handled because I've written a number of books about nutrition. And as far as cleaning the teeth, I developed a way to get the teeth clean. But I went to about 100 dentists and hygienists, and I said to them, "Somebody comes in with periodontal disease. How do you handle it?" And they said, "Well, we have them come back every 3 months to have their teeth cleaned." And I said to them, "Are their teeth dirty when they come in on those 3-month visits?" And they said, "Yeah, that's why they're there, to get their teeth cleaned." And then I asked them something nobody ever asked them. I said, "Do you think their teeth were dirty the day before that visit?" And they say, having never been asked that question, now they're stunned. And they say, "Yeah, yeah. How about the day before that? And the day before that, and the day before that?" Turns out the only time the teeth are clean are the times they're cleaned in the dental office. 4 days out of 365. They go once every 3 months. And no wonder very few people ever get better. Well, some do. So I developed a way to keep the patient's teeth clean virtually all the time. And
That's
I wrote a little booklet. I wrote a little booklet called Secrets of Toothbrushing.
that's a miracle. How did you do that? And what does that mean?
Well, when I was practicing, I said to one of my patients, "You really got to keep your teeth clean. I'll tell you what I'll do. I won't charge you. Come in every single day, including Sunday." I had a home office, so it didn't matter to me. Including Sunday, and I'll clean your teeth. Nobody took me up on it. I thought that was astounding. So when it came time to actually figure out how to clean your teeth, the answer is simple. Frequent brushing of your teeth, period. Now, there are people who brush their teeth once or twice a day, and they're spotless. and their gums are great. But those people are few and far between, and they're almost always younger. And I rarely I saw them, but I hardly ever saw them. You got to brush your teeth 5 times a day. So I say 5 times a day, and people say, "Are you nuts? I'm not going to brush 5 times a day." I said, "No, listen, I want you to brush when you get up in the morning." Well, people do that anyway. I said, and then brush after breakfast. So it's before and after breakfast, and before and after dinner, and just before you go to sleep. You're home at those times. I only want you to brush for 60 to 90 seconds because less than 60 is usually inadequate, and more than 90 is wasteful. Oh, I don't want you to waste any time. Seconds we're talking about. I don't want you to waste any time. And use more than one kind of toothbrush because no one device cleans everywhere well all the time. In fact, if you gave the same brush to two different people with the same instructions, they'd clean differently. So you have to use more than one device. A power brush and a manual brush are two different devices. Two manual brushes with the bristles designed differently are two different devices. All right, so 5 times a day, 60 to 90 seconds each time. And basically that's it.
Do you favor the manual toothbrush or the electric one?
What I say is, I don't care if you use a lawnmower, as long as you clean your teeth and don't do any damage. I don't care what you use. Doesn't matter to me. But there are some brushes that are better than others. There's this brush called the Collis Curve, Collis, Collis Curve. He's making them used to be in Texas, but now it used to be somewhere, no, in the Midwest. Now he moved to Brownsville, Texas, and he's making them there. Still U.S. made. And it's the best manual toothbrush I ever saw because it's shaped like this, you see? And so it
Yeah.
cleans both sides at the same time. And there are little bristles coming down on the top, so it cleans the biting surface as well. They come in designer colors. They last a long time. And you just go back and forth, back and forth, back and forth. So it's the easiest of motions. So that's one of them that I use. And the other one I use is called a Quip. It's a power-driven toothbrush. One AA battery, which lasts forever. And it cleans your teeth really well. So that's the armamentarium that I suggest. But then there's a toothpaste that nobody's ever.
Well, let me stop you here because it's interesting what you said. I mean, it's basic, I would say, right? Every dentist in this world would advise their patients to brush their teeth as often as they can.
No, they say 3 times a day after every meal.
Well, 3 times a day. I mean, very few people do it 3 times a day, right?
Right,
Even
if the
3 times a day.
patient says they're doing it 3 times a day, you can rest assured they're doing it twice.
Well, okay, but that's what you're saying is more than 3 times a day.
All right.
Because many people eat more than 3 times a day.
But notice I didn't say anything about lunch.
Okay.
So in the middle of the day I don't want you to say, oh, I don't want to rest in the middle of the day or at work. I don't want to give you any excuses. Before and after breakfast, before and after dinner, and just before you go to sleep. And there are reasons. And in the booklet, it tells you the reasons why you do it then and not some other time.
Okay. What do you have any evidence in your hypothesis that brushing this way it's actually decreasing periodontal disease?
Well, in a short time before I retired, I actually tried this with some patients. And the patients who followed the advice got better. But more than that, when I first graduated from dental school, I used to have to clean the inside of my lower teeth every night. Every night I had this hard, crusty calculus on my teeth every single night. And then it hit me. Got to keep it clean. Now I know that dental plaque, that soft, sticky substance, forms every day in your mouth, in everybody's mouth, some more than some less. So I figured I got to keep it off. And just the thinking process was I got to brush more often. So I went to the American Dental Association. I went to the Nassau County Dental Association when I lived on Long Island, and I told them I have a cure for periodontal disease. And I went to several schools, and they said, "You have any proof?" I said, "Wait a minute. Everywhere you go, it says dirty teeth cause the problem. So if you clean the teeth, don't you think the problem will go away?" And they said, "You got any proof?" I said, "It's so simple. It's so obvious. You're telling me how to fix it." And they wouldn't accept it. They wouldn't accept it. I was stunned. But I said to myself, I'm okay. Let them suffer. And you do suffer. Periodontal
Well,
disease.
yes, but um, I just want to make a little comment here. The lobbying of the dental world is for them to have work to do on patients. So I don't know if necessarily it's their interest to advise the patients the way you do it now, so they don't have, any kind of, cavities or dental disease or
Well,
gum
first of all,
disease or anything like that. So
cavities
the moment they would advise that, they won't have patients anymore to
I have an
come into
answer to
their
that.
offices.
I have an answer to that. First of all, cavities, dental caries is a dietary disease. You get that because of what you eat or don't eat. It has very little to do with clean teeth. We often see people coming in with filthy teeth and no dental decay. And we often see people come in with absolutely clean teeth and a lot of dental decay. They're separate diseases.
Okay.
Separate
Well,
diseases. Now,
tell
as far
tell
as
me more about this because I'm interested. Why is that?
why are they separate diseases?
Yeah, why even if you brush your teeth and you have a clean mouth and clean teeth, you still get cavities,
Okay, let me ask you
and
this.
the other way around?
If you woke up with a hole in your leg, would you be alarmed?
I would.
Who wouldn't, right? A hole in a tooth should sound the same alarm bells. There is no body part that is designed to develop holes. And the teeth, the hardest structure in the body, when it turns into a soft, smelly, decayed mass, you got to say to yourself, something's wrong. But the dentist doesn't see that. In fact, I used to ask patients about the destruction caused by dental decay. And their answer was, well, that's not destruction. I thought that was incredible. It was
Yeah.
like, what? And these weren't dumb people. These are really high class people. Stupid, or no, ignorant, but not downtrodden or fog brained because they had nothing to eat. No. So they thought the dental decay was not destruction, but it is. A hole in the tooth. I used to have a lecture called Hole in Leg, Hole in Tooth.
Okay. Any difference in the type of brushes that you see in the current market? Does it make any difference what you brush with?
As I said, no, it depends on who uses it and how. Two people with the same device will clean totally differently.
So it's a matter of technique.
It's a matter of using the brush to clean your teeth. Like I said, there are a lot of ways, you can brush like this, but there are certain ways. You got to get the brush onto the tooth.
Okay. You're talking about toothpaste.
And
That's
just,
another discussion.
just so you know, dental plaque, that soft sticky substance, always starts at the gum line. It always starts to develop at the gum line. So all of your efforts should be focused toward the gum line and the tooth, not the gums, the tooth at the gum line.
Okay. Okay. Do you think the gum disease it's worse than any other cavity or like
Oh,
tooth disease?
absolutely. You'll get pain from cavities, but you'll lose your teeth from gum disease. And one of the things I say is being old can be tough. Being old without teeth is a nightmare. Wait, but I told you I had an answer for that question of yours. You don't want to get rid of the things that give you business. If the dentist designed their practice to treat those with periodontal disease, and the American Dental Association says 3 out of 4 people have periodontal disease. So if the dentist were to institute this program that I have, they will make more new profits that will rival their current gross income. Because there are so many people out there that have to be treated. And the reason they have to be treated is periodontal disease is not a disease of just the mouth. Periodontal disease has been linked and associated with some of mankind's most devastating afflictions, including Alzheimer's and cancer and pregnancy and birthing problems and kidney problems and all kinds. The list grows every month. It grows longer and longer. So periodontal disease is incredible. And if you, and this is part of my healthcare plan, if you allow all the dentists or instruct all the dentists to treat periodontal disease the way I say to treat it, frequent brushing of your teeth and nutritional support. And that's incredible because 85% of all illnesses have a major malnutrition component. So if you get all these people as part of the nationwide healthcare plan, which the Republicans don't have any, the Democrats don't have any, I offer this one and nobody says anything. If you get the dentist to do this, they will treat the periodontal disease, and part of that treatment is nutritional support. And since 85% of all illnesses have a major malnutrition component, by treating that many people nutritionally, and you got to do it the right way, nutritionally, you will decrease much of the afflictions and degree of afflictions in the healthcare business. And that will save you, and I figured it out, $500 billion a year. Save America $500 billion a year. Oh, the 3 children they currently spend on healthcare.
Do you think there is a genetic component in this?
There's a genetic component to everything.
So in other words, if you take someone who had parents, for example, with very bad teeth,
yes, we find
and
there is a hereditary component.
right,
But there is that
you take them and you brush their teeth 3 times a day. Do you think they won't get dental disease?
I think if you keep the teeth clean, I'm not saying 3 times, 5 times. If you keep the teeth clean, and the way I do it, and I didn't finish telling you how, but the way I do it, it's cleaned virtually all the time, then that will either remove or reduce to insignificance that component of the disease. However, I have had patients in my practice, one patient, a young guy, relatively healthy, I thought, strict nutritional kinds of stuff, always did the right thing, and he lost a lot of bone support from the 2 front teeth and the 6-year molars. And that's a specific kind of affliction. Those teeth and those teeth. You get that, and he was clean, he was nutritionally strong, and he still had the problem. But those are very, very rare. Those are rare. You don't get those kind.
So what is your plan? How do you keep the teeth clean all the time?
Well, first you get the dentist to clean the teeth. And you get him to clean the teeth totally. A lot of dentists and the hygienists don't clean the teeth totally. But you got to do that. And sometimes you have to do anesthesia to get down in there. All right. But once it's clean, keeping it clean is the key. 5 times a day, more than one kind of toothbrush throughout the day. And I didn't tell you this yet. I started to. There is this toothpaste that's been on the market for a long time. It's made by New Skin. I have nothing to do with it. It's made by New Skin. It's called AP24, anti-plaque for 24 hours. What that does, it puts this microscopic slick coating on your teeth so nothing can stick to it. And if plaque can't stick to your teeth, you can't get a buildup. You can't get gum disease. And I suggest you use that all the time. But when you have active gum disease, I suggest there's another toothpaste. And that's called Closest. Used to be called Closest too. But now it's called Closest. It's made by Ropar Pharmaceuticals in Phoenix, Arizona. What that does, that has a special ingredient called chlorine dioxide. That is known to kill all those bacteria in your mouth, all those harmful bacteria.
In
fact, they spray that on fish to prevent
chlorine dioxide. Sounds to me like a poison.
No. In fact, they have a rinse, and they went into universities and had the university students swallowing this stuff over the course of weeks, and they took lab tests before and after, and there was no problem.
Okay, so let me ask you something. Do you think the commercial toothpaste in our market right now, which are mainly...
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
Big names, right? I'm talking about like Colgate, Crest, all this type of, right? Do they have any advantage over other toothpastes, or is just a matter of price?
No, in fact, I don't know if you remember this, but years and years ago, one of the toothpastes used to sell Gardol, Gardol, an invisible shield. So people were paying for the emperor's clothes, that kind of stuff. No, you can clean your teeth very well, very effectively, without any problem, with just toothbrush and water. But you have to use the toothbrush well.
Correct. So do you think basically the toothbrush is the main factor to clean the teeth, not necessarily the toothpaste?
And frequency.
Because I hear a lot of people talking about the fact that toothpaste is not something that we should actually use. I'm talking about a commercial one that it's in the market right now, because it has a lot of ingredients that are not necessarily good for you.
It has fluoride in it.
And fluoride in it.
No good.
So what is the compromise here then? If you think, and they have labels on all the toothpaste, basically, don't swallow it, they're not good for children, be careful what the children are doing with it and all this stuff. I mean, there's a hazard out there, right, with them. How do you manage this?
There's a hazard with everything. This world is not perfect. And the reason you use toothpaste, it has that foaming action, and it does have some kind of detergent action. But you can overcome, you don't need it. Just like you don't need to use dental floss. You don't need to use dental floss unless you have something caught between your teeth, in which case only dental floss will get it out. You brush the way I tell you to brush, there's no plaque buildup.
Okay, so how do we brush then? Tell me, how do I brush then?
Well, if you use that callus curve, it's just back and forth.
Okay, so why everybody then recommends flossing? I mean, it's one of the main thing for
And
a lot of dentists to prevent
right,
cavities and
all
stuff.
dentists say floss, floss, floss. And it hasn't changed the periodontal disease or gum disease picture at all. At all. Because it's the brushing that does it. You brush the way I tell you to do, you don't have to use dental floss. You get something caught between your teeth, you have to use dental floss.
I see. Got it.
Even then, I still sometimes, very rarely, floss my teeth. You
Yeah.
know, just
Okay,
because
let's go to talk a little bit about mouthwash. What do you think about that?
I think it's worthless.
Why?
Well, why do you use mouthwash? For your
Well,
breath?
I mean, technically, they recommend mouthwash to have a cleaning effect of your mouth.
But
If you,
if you brush like I say, you don't need it.
okay,
Well,
why?
I took a lecture one time, and the instructor, we were all graduates, we were all dentists already, and the guy up at the podium flashes a picture and said they have this in Europe. It's a rinse, and he showed a mouth before filled with gunk. He said, and then they use this rinse, and he showed a mouth afterwards, and it was clean. And everybody said, "Wow, that's great." And the guy said, "It's not true." I just want to let you know it's not true. You can't do that. You got to brush your teeth. You got to brush your teeth.
I see.
Unless you do
I
it
see.
for the odor. And if you do it for the odor, remember I told you about that toothpaste, Closest? They have a spray also because the chlorine dioxide kills all odors. Onion, garlic, alcohol, tobacco, that kills all odors. So if you've been drinking and you're stopped by a cop because of the way you're driving, spit it out, you no longer smell from alcohol. You're still drunk. You still can't walk a straight line. You still
Right, I see.
your words. But you want to do that? It comes in a nice spray. You could do that.
Interesting. Okay, so mouthwash is waste of time.
Waste $300 million a year, I think. Waste of time and money.
Well, most of the mouthwash out there is basically just alcohol-based water, right?
Right.
Like
And
it's
alcohol will dry out your skin, your mucous membranes.
right, right. What do you think about those mouthwashes with properties for, like mouth sores or any kind of infection in the mouth? Do they work?
I designed a new oral examination as opposed to the typical dental examination. I call mine an oral examination as opposed to a dental exam. And and it takes just 2 minutes longer than whatever the dentist does now. And it gives you a wealth of information the dentist never even thought he could see right in front of his eyes, and he misses it all. And one of them is canker sores. Canker sores are caused by a lack of, well, remember I said 85% of all afflictions have a nutrition component? You want to get rid of canker sores? You give yourself calcium and vitamin F. And in a day or so, the pain is gone. The sores are still there and it takes time to heal. But those people who take calcium and vitamin F never get canker sores. In fact, my new examination will enable you to determine accurately the patient's nutritional status. You ever hear of nutritional status? You ever hear that term?
Yeah, of course.
Nutritional status, nutritional strength. So I went to physicians and nutritionists and dietitians. And I said, how do you determine the patient's nutritional status? And they said, we really can't do it. We don't know how to do it. And the physician said, we're much more disease-oriented than health-oriented. So nobody knew how to do it. And if you take somebody into the hospital and perform this battery of very expensive tests, all you get back are a look at that patient's biochemistry that moment, that day, maybe even that week. But if you do my examination, you get a picture of the patient's nutritional status as it is as it was years and years and years ago, and how it probably will be in the future. So what? So what's the benefit of nutritional status? You know that when people go and have operations on the gurney, in the operating room, bad things happen. They die, or their system shut down, or they have a stroke, or they have a heart attack. And I asked the surgeons, I said, why? Why does that happen? Assuming everybody did everything right. He says, we don't know. All we know is we stress the patient more than that patient can handle, and they had this problem. Now, what they don't know beforehand is the patient's nutritional status, because when you're in, you know what stress is? You've used the word stress a zillion times, right? You've
Yeah.
heard it 10 zillion times. What is stress? Well, I know the answer. Never ask a question, don't know the answer. Stress, biologically, is the depletion of nutrients. You deplete nutrients to a sufficient degree, your systems won't be able to work because they don't have the nutrients they need to have it work. So if you go in and for an operation, a stressful operation, and what operation isn't, and you have a low nutritional status, the possibility of you having an untoward event in the operating room is increased. You're a high risk with low nutritional status.
That's true.
Nobody knows how to determine the nutritional status. I can teach a dentist how to do it without any lab tests, accurately, repeatedly. You can repeat it. Makes absolute sense. And I can tell you whether you're a high or low risk on the operating table by your nutritional status. And it's obvious. It's blatant right in front of your eyes. For example, you have the patient stick out their tongue. And you see their tongue has all kinds of deep cracks in it. No children have that. I've been looking. I have 2 3-year-old great-grandchildren. They don't have it. Nobody I've seen that. I've asked pediatricians. They never look, but they never saw it. That's one thing. You look at someone's ears and they have decreases in their earlobes. That's another thing. You look at canker sores. So I have 30 things that the dentist should look at. I took 7 of them. And I said, these are the 7 simple signs of low nutritional status. And I think it should be hung on every corporate wall, in every healthcare facility, and taught to our children, because they'll grow up knowing these things. So what are the 7? Dental caries. Cavities are a dietary disease. Gum disease. Poor nutrition makes it worse. Dental caries, gum disease. Digestive problems. An acidic pH. Just take the pH of their saliva. It takes 3 seconds. You take a piece of paper, stick it in, see what color it changes. You know, I can't think of the other 3. I can't. It's amazing.
So no, but this is very interesting. I want to kind of stop here a little bit and go deeper. So you were mentioning tongue, right? Tongue is one of the, I would say, very important organ in our mouth, in our oral cavity, that many dentists basically ignore.
And physicians.
And physicians, yeah. So, and there's so many studies out there with diseases that you can diagnose by the appearance of the tongue. Can you tell us what you found in your career about this? Like, is there any specific thing that you found out?
Well, there's this book called Dr. Chi's Tongue and Fingernail Analysis and Diagnosis. And Dr. Chi comes from the Orient, of course. And he wrote it years ago. In fact, I think he has a 2nd and 3rd edition now. And I got it a long, long time ago. And it's incredible. Because you look at the tongue. And so when I used to lecture around the country, I would ask the audience. It was mostly dentists and hygienists, some physicians. And I would say, what does a healthy tongue look like? This, that, the other thing. Finally, we got it down to 3 things. It's pink or pinkish. It's regularly elliptical, wider in the back than it is in the front. And the anterior 2/3, the dorsum, the top of the tongue, is homogeneous. And so we all agreed to that. And then I said to the audience, any of you guys ever see a yellow tongue? Oh, yeah, they all raise their hand. Yeah, we said. Was that part of your healthy picture? No, that wasn't part of our healthy picture. I said, so what do you do about it? Oh, we don't do anything. I said, any of you guys ever see a tongue that had scalloped borders, teeth mark indentations? And oh, you see it all the time. Is that part of your healthy picture? No, we just told you it was regularly elliptical. Well, what do you do about it? Nothing. Yeah, I said, have you guys ever see any tongue with deep grooves in it? Scrotal tongue, fisher tongue? Oh, see it all the time. What do you do about it? Nothing. I said, wait a minute. Isn't the buck supposed to stop? Aren't you the doctor? Aren't you supposed to, in dental school, you learn what the normal is. You also learn what the abnormal is, but you learn what the normal is. And if you don't see the normal, you see something else, it should stop you. You should say something like, what caused this? How often we see a patient go into the dentist's office and the dentist says, oh, you need $40,000 worth of dentistry to get your mouth back into shape. And the patient writes out a check, gives it to the dentist, and the dentist does this beautiful stuff. And it comes back as beautiful, comes back really beautiful. And the dentist never once says, what caused this? And I
Yeah.
tell them, and to change the profession, all I'm asking them to do is say to themselves, what caused this? And then go figure it out yourself. They'll come up with the same answers I came up with. They never say what caused this.
What do you think about the acidic environment in the mouth? I mean, this is one of the things that
One of the
a
things,
lot of
one of
people
the,
debate.
one of the things that in like 30 things that you look at is the pH of the saliva. Remember I told
Yeah.
you? Body fluids, except for stomach acid, stomach fluids, body fluids are neutral or slightly alkaline. And the saliva, unstimulated, in other words, you haven't had anything to eat or drink for an hour, should be neutral or slightly alkaline. So I went into, and I found in my practice, most adults are acidic or highly acidic. And in an acidic environment, acid states promote disease. Acid states will dissolve the minerals in your enamel. So I went into my public school. I think it was grades 1 and 2 or 3 at kindergarten. And I got permission from all the parents to take the pH of the kid's saliva. Almost all of them, alkaline. Kids are alkaline. If they're acidic, that should like ring a bell in your head saying, oh, wait, shouldn't be. I better look further. Kids are almost all alkaline. Adults are almost all acidic. And that's one of the signs of low nutritional status, pH of the saliva.
Well, with all due respect, I don't think we have any kind of nutritional classes in our school system. Like,
Oh, we do. Wait, we do.
When?
The dentists do. The dentists do. And you know what? They don't call it nutrition. You know what they call it? They call it anatomy, biochemistry, physiology. All those sciences that they study have the nutritional things in it because it tells you the bones need vitamin A, B, D, and then the nerves need.
I understand that as part of the medical training, but for the patients, no, like our system does not have a nutritional classes in, the first 12 years of school. When you graduate high school, you don't really know what to eat and how to eat. And that's going to affect the rest of your life when you form a body like that you eat whatever and, fast food things and acidic things and candies and sugar and all this stuff. This all goes into your mouth first. And this is bad for your teeth, first of all.
For your body.
For your body. Next.
Your body.
But what do you think about this sugar epidemic that's going on right now?
Well, I would much prefer that you eat sugar rather than those artificial sweeteners.
Yeah, no, obviously,
much prefer that. Sugar
yes.
Those artificial sweeteners are death.
Yeah.
And the preservatives, you know what they're finding now? When they dig up bodies that have been buried for a while, they're not as decomposed as they used to be because of all the preservatives that they're eating.
The preservatives of the body.
Right. I mean,
that's morbid.
They don't look like they just died, but they're not as decomposed.
Oh, God. Okay.
You asked me several things. I had 18 thoughts run through my head. Now I can't think of any.
I know. No, we're talking about the sugar epidemic, and I think from a dental point of view, I think it's a big impact in how much sugar kids eat.
But because of the cavities that they get. But remember, cavities are a dietary disease. It's not just the sugar. It's your entire diet. And when you're eating sugary foods, I guarantee you're not eating the healthy foods.
Yeah.
And the healthy foods are going to give you whatever nutritional support you should have. So you have a low nutritional status, and it'll show up as cavities.
Yeah.
That's one way.
Okay, so tell us, what are you doing right now to spread the word on what you just said?
I took your advice and I came here.
Well, I'm trying to spread the word with this podcast, but
I don't.
Do you have?
I don't spread the word. I've written about 9 books. And I don't write for people to read. I don't know. I write to get the ideas out of my head. Because until I do, it just gets jumbled up. And I'm always having ideas. In fact, there was a time when I hadn't had an idea for a couple of days. And I became worried because I always used to get ideas all the time. I used to get up in the middle of the night to write things down. And I wasn't having that. I got really, really nervous and upset. And then they started coming again. And I realized they never stopped. The ideas, they never stopped.
That's a good thing.
Right. It's a great
Um,
thing. So what do I do?
so
I don't do anything. People ask me, I used to be a zealot. I'm not that anymore. You want to hear what I have to say? Okay, good. Your problem, not mine.
yeah. Well, it's been a pleasure having you, and I hope everybody learned something about their mouth and their dental hygiene from this conversation. And I hope we can have more of those. Maybe we'll come back with other topics.
All right. Now, one of the things I offer this book, Secrets of Toothbrushing. I just give it to you electronically if you ask for it.
That's great. Where can people ask for it?
It would be my email address. Can I give it?
Sure.
Okay, it's 123 dr, as in doctor, jwg, my initials, at gmail.com. So it's 123 drjwg at gmail.com. Has a little bit of a rhyme in there.
Oh, excellent. Thank you so much. I appreciate your presence and wish you great success. Maybe we'll come up with some more ideas.
I have plenty of ideas. I wrote 9 books. I obviously have a lot of ideas. So anytime you want me back, just ask me.
That's great, Jan. Thank you so much.
Thank you. Good night.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.